Mics are unmuted. We're set. Okay, good afternoon, everybody. This is the county's weekly finance meeting today, April 13, 2022, on the hour 1:35. We'll get started, and we open, as always, with a period for public comment. If we have any individuals from the public in the house or online who wish to address, we do not apparently. So that will move on to item 3. We have the minutes in hand of the April 6th meeting of this year. Entertain a motion.
Move to approve minutes of April 6th.
I second.
Moved and seconded. All in favor indicate by saying aye.
Aye.
Motion carries. Okay, that brings us to the part of the meeting that is the topic of discussion for today. We have one topic, multifaceted topic, but it's the fiscal budget for 22-23. We have a roundtable discussion schedule here, so all of our fiscal officers are with us today. Thank you for being here. I guess we'll get this started. Who's taking the lead on this today? Go ahead.
Good afternoon. Basically, this is a discussion of the fiscal budgets, giving you updates from the fiscal officers on any program changes, funding changes, any trends that they're seeing, in the future for their programs and for their funding. I think you start.
Oh, no, I'm gonna let Lisa. She's the
Okay.
reason why you bring your fiscal.
I tried to find my notes from last year because they were basically the same as this year. I just wanted to start by saying typically fiscal year to fiscal year, we usually jump about 4.5% to 6% increase in our expenditures. But the last 2 fiscal years, we pretty much have stayed flat because of the COVID pandemic. And I'm anticipating this coming year, or this fiscal year we're just ending, is going to be the same. I looked at period 9 of last fiscal year and compared it to period 9 this fiscal year, and we are almost exactly the same number. So I anticipate we'll be under budget and under match again this fiscal year. We did receive our 22-23 certified numbers from the state. They gave us everything we asked for in our needs-based budget. So that's exactly what I put into the county budget. I don't anticipate we'll come even close to spending that because we're still running level. We're not seeing any increases in our placements and stuff. So we always put in what we're certified for just as a placeholder in case something wacky would happen and we do spend more than anticipated. But I believe we'll be in under budget again next year. The only changes in the program were October 1st of 2021, the Families First Prevention and Services Act became effective. The change to us is that we can invoice for some in-home services through evidence-based or Title IV-E, which currently we don't have any programs right now. The state is working on getting more evidence-based practices approved, but right now we don't have any. And our specialized settings and our congregate care. So anybody who's in congregate care, if they're Title IV eligible, we can only claim the first 14 days of their placement. We can still claim all the administrative cost of that placement, but just not the placement maintenance. It doesn't affect us greatly. We typically have anywhere from 15 to 20 kids in congregate care, and of that population, maybe 4 to 6 kids are Title IV eligible. So it's not a huge impact to us. So it probably will take a year or 2 to see what the actual impact is in the 4A funding, but I don't see it being a great impact. And then we did have 3 positions that we requested in the fiscal year 23 or 22-23 fiscal year: a supervisor, a caseworker 3, and a caseworker 2. Okay, that's all I have.
Right. Thank you. Want to go up next, Jack?
Sure. I'm going to give an overview and I'll fill in some blanks.
Sure. So our funding from the state is going likely to remain flat. However, there is possibility of increases in federal funding. We suspect possibly some state opioid response funding increases. And that's mainly to cover programs that DDAP had asked us to start in the current fiscal year. So if they don't provide that additional SOAR funding, we would most likely have to look at or not we would continue those programs. They were specifically what they were asking for, a housing program, and recovery support, yes. That's the latest one that they had just asked for. But overall, everything else would be flat. We're not seeing any increase in staffing. We're hoping this year to get up to full staff. Past 2 years, we've had a couple open vacancies. So we're working on filling those, but hopefully we'll be able to have those filled this year. So overall, nothing major, just hoping that federal funding gets pushed through DDAP to us as projected.
I just want to add a few things. There's always some clouds on the horizon, some things that we need to anticipate. And going into next year, one of the things that the state has required, our state agency, the Department of Drug and Alcohol Programs, is that all of our treatment providers align their services with the American Society of Addiction Medicine placement criteria. And there are additional costs for doing it. So we're anticipating that rates will increase in our contracts with our providers, both outpatient and inpatient. So that's something that we expect to see. We're also aware that we have enjoyed one of the few silver linings of the COVID-19 pandemic over the last couple of years. And that is that because there's a national emergency that is still in effect, nobody can be discharged from medical assistance. You may be hearing this from Annie as well. And so the medical assistance roles for Cumberland County and Perry County have just continued to grow. That means that folks who might normally get kicked off of MA and rely on us for treatment funding that hasn't happened. So it's been less pressure, less demand on our county funding and county managed treatment services. We expect that the national emergency will no longer exist. And at that point, they will begin the process. Although what we've read is that it will be sort of a Herculean task to review all of those MA members and go through the process of determining if they're still eligible. I think it'll probably be a little bit like when everybody started applying for unemployment comp at the beginning of the pandemic. There will be long waiting lines, and so it's going to take a while, but that will start to happen. And so we think that will increase. It'll decrease our medical assistance business through our 5-county Health Choices Corporation, but it will increase the amount of treatment services that we're being asked to fund. And then the other thing that I'll mention that's just an ongoing issue, you've heard it over and over again, is that the challenges to our providers for recruiting and retaining quality staff continue to be an issue. Questions or comments about any of that?
Thank you. What's next, Paul?
Sure. My budget remains relatively static for this coming fiscal year. We're still receiving grant money from AOPC for the overdose intervention work. We have probably about $10,000 remaining in that. The biggest change in my budget will be with our move to Business Central. Hopefully in the next couple of weeks, we have to start paying rent now. So they'll move from aging to my department. That's all I have.
And Sue?
I'm happy to go first. We find ourselves in a pretty unusual position. See, Linda has joined us virtually, so she can weigh in as well, but our commissioners, you folks are well aware of our situation where we have anticipating about a $500,000 deficit for the current fiscal year. And for the next fiscal year, I feel very stuck with whatever the governor's budget ends up being approved at. As you know, legislators have proposed, Governor Wolf has proposed a 12% increase to county mental health base dollars. 36 million is the actual amount. I don't know how this will end up. If we end up with flat funding, I fully anticipate we're going to have to make cuts to our programs to live within our budget. Every provider that we contract with is expressing, much like Jack has talked about with the staffing needs. You know, we have programs that are literally one staff member away from needing to close the program because of the retention issues that we're struggling with. Salaries are difficult to manage in the environment that we have currently. So I feel, you know, again, pretty stuck with planning for the next fiscal year because we don't know how this is going to end up. We do have the resources using the ARPA funds, you know, potentially as a short-term help. I know Linda has shared that she has basically put into our budget proposal a 6% increase. We fully anticipate needing to revise our budget because we don't know where this will be. Similar to Jack, we've had cost centers that typically are MA compensable cost centers because they're treatment services, outpatient, certain community treatment, inpatient, that we have not spent much money in for the last couple of fiscal years because of having high levels of Medicaid recipients in the community. As those Medicaid numbers drop, I fully anticipate that we will be needing to spend even more resources in county-based funded treatment services. And so we are going to be looking at the fiscal regulations to see what services must be paid for under regulation. And then the other services, we are going to have to make some difficult decisions of how do we manage this. Concurrently, we've seen the greatest increase in service needs in the last 2 years. And I again, we shared at the finance committee meeting, the increases that we're seeing, as well as, you know, even in crisis, some of the challenges that we're seeing, again, meeting the community needs. And no capacity. We have a very difficult time getting people into treatment services currently because there just doesn't seem to be enough therapists and not enough psychiatrists. Feel free to ask me questions. I'll be happy to answer.
So I remember the finance meeting that we had where you had talked about maybe Commissioner Eichelberger going to talk to some legislators. Have we moved that forward? Is there a way that maybe Commissioner DeFilippo and I can help with that? Because the budget is not what we need it to be. As Stacy has said over and over again, we're not going to let this happen. Right? We have to have these services funded. And I see this, you know, if mental health isn't funded, I see it trickling, and it's not going to trickle. It's going to just like tsunami to children and youth, to drug and alcohol, to the courts, to the prison, you name it. We're going to see the effects of a lack of mental health funding. So, you know, I think it's our responsibility to go and push for those dollars. But I am wondering, are we anywhere in that, or what can I do to help?
Well, I have spoken with Commissioner Eichelberger. He's our liaison to our MHID advisory board. And we were talking about meeting with Samantha soon.
Okay.
In order to pull together hopefully some talking points and basically a direction how we might successfully be able to make sure that individuals who are in the policy making arena will have a good awareness of what our needs are. And then, you know, then those decisions ultimately are theirs to make, and we will deal with whatever that decision is. But we, you know, will need to be making those hard decisions potentially.
Katie, you mentioned a number. The governor is proposing how much of an increase?
36 million across the state.
It is being blocked.
I'm sorry?
Is it being blocked?
There's a lot of conversations.
But
About-
Representative Saylor apparently has an issue with it.
There's a conversation about, and Representative Saylor chairs the Appropriations Committee.
Right.
And he is asking a lot of questions about counties and their data submissions. And we've worked really hard the last 3 years to strengthen our data submissions. I will add that the system that we are using The state system that we are using is complicated, and many of our providers are struggling to be able to use the system. And unfortunately, we, the county, can't even see what they've done in the system. So that's stuff that we've asked for. We've asked for access so we can support our provider network to see how we can support them getting into the system so our data can be submitted in a stronger way. We've done a good job, but we're not there yet. So
I had another question. Oh, here it is, Annie. So let's say that this $36 million makes it through the budget. What do we think is coming here? Because I mean, if I'm remembering correctly, we generally are giving up tax dollars, right? The county is generally providing tax dollars for other places. So do we have any idea what would be coming to Cumberland County? Would it be enough? Do we need to go push for that?
I believe at our growth rate, I believe we're still going to be having some struggles to be able to meet the needs. Our growth rate is about 16%. The governor's proposed increase is 12%. So unless the state reevaluates the allocation structure across the Commonwealth, I still believe that we will be struggling. Linda, please feel free to weigh in as well.
I was trying to look up some data. It's only this 12% will only be based on state dollars that are in the budget. And that's the bulk of MH. So it's around 8 million for Cumberland County. So 12% of that, without sitting here doing a quick calculation, if we got that much, I put in a 6%, we'd get about 900 and maybe 900,000, because we never get a total 12%. When they cut the budgets years ago, they said they were cutting 10%, but we didn't get actually a total 10% cut. So it's all up in the air, I guess. But maybe we would get 900,000, which that would help us, but not guaranteeing it.
Yeah, even if we use that as a tentative increase, I mean, we can go back through and try to see if perhaps that may be enough, but I must be honest and say, I don't believe it will be.
Yeah, I don't think so either, just based upon all the times you've been here, Annie. Going
This
over
is
the
a very
budget.
difficult time.
Yes.
What's disappointing is that from all forecasts, the state's in really unusually good position financially because tax revenues have come in above what budgeted the last couple of years. They have the benefit of the additional federal funding. And so it seems like if there were ever a year where they could afford to increase funding in some areas where there's documented need, this would be a year. So it is disappointing to hear that it's receiving a cold reception.
I suppose these will be ongoing conversations as we move forward, just trying to see how to continue to navigate this with as little, hopefully with as little pain to our community and the people. in this. You want to follow?
I'll follow you.
It has to be more optimistic.
I'm trying to bring it up. So on the ID side, I think our budget will be flat, but there is a waiting list initiative in there again this year. It pretty much mirrors what it was last year. They're saying there will be 18.8 million in the waiting list initiative, 100 consolidated waivers, but they will be held at the state for emergencies. And we will have to go through a request process in order to get them. But they will have 732 community living waivers, which is valued at about $70,000 at this point a piece across the state. So typically our allocation of that 732 is around 20. That's not a lot, but it's still plenty. But the caveat there is that they have to be given to folks who do not receive any services yet, who are sitting on our wait list. The only thing that they are getting is supports coordination and no other services. So it does help reduce that statewide waiting list, which is up around a little over 12,000 individuals. So they are focusing on bringing down that statewide waiting list. And so we bring people off of that list. We are also bringing folks, our numbers are going up because we are having a lot of referrals for folks with autism. When they opened autism up under ID, they did not give us any resources to go with it. So we have to figure out where to get those resources to support those folks with autism. What else? So I think our base will be flat, basically. They are giving us some ARP money still for administrative functions like staffing that they had promised us a few years ago, but were unable to give it to us. So now they're going to give it to the counties through ARP money, and also for respite and family support. So there'll be a little bit more money coming into our budget under those couple areas. Like I said, we still have our waiting list in Cumberland County, which is, there's 277 folks sitting on that waiting list. What is happening is that children and youth, mental health, ID, we have this big group of complex cases. Sometimes we are able to move somebody in to services under ID. Not often, but sometimes we can help there, but then that preempts somebody that's on that waiting list. So that's what happens there. And again, as you've heard, and I've been saying, the staffing crisis is affecting our programs. We've had 3 group homes who have temporarily closed and moved, actually consolidated into another home that's open just so they can move all the staff over there. They say that keeping the group homes closed is not permanent. They are hoping to open them again whenever the staffing crisis, gets a lot better. Our capacity is still down in our day programs. And so we typically have money left at the end of the year these past few years. And we've been able to do some other projects that we have needed to do to help our providers with that money. So I think that pretty much covers it as far as ID. That's where we are at. Any questions on that?
May I
Okay,
interject?
thank you. Yes,
Yes.
Linda.
On the actual budget, I did do a slight increase to our allocation because the state has decided as of January 1st of 2022 that they are raising rates for certain areas of service. And so they have told us that money is going to follow that rate increase, and that rate increase, to my knowledge, will be through March, I believe, of 2024. So we did do a slight increase to the IDD budget for that, as well as what Sue just mentioned, the extra administrative expense allocation that we actually have already received. We haven't received the money, but we've received the allocation.
And I forgot to address early intervention. Early intervention referrals are very, very high at this point in time. In 2021, we had 1,060, which is something that we have never, ever had before. In February of this year, we had 99 more referrals than we had at this time last year. So we are just really flooded with the number of early intervention referrals that we are getting.
So what do you attribute that to?
I do not know. I have no idea. And when I ask my staff, they don't have any idea either. It's just, they're just coming out of the woodwork. And we do not know. As soon as I figure that out and they give me any information, I will share that. But at this point in time, I do not know. We hired a new EI supports coordinator. And just as we hired her, someone else left. So now we're back to hiring another one where we actually need a second one already. But the budget does not support that at this time. So we are going to try and muddle through until we get a clear look at the early intervention budget, which we don't have at this time yet. Correct, Linda?
That is correct. We don't have our final for last fiscal year. We don't have our allocation for this fiscal year. And they have given all of the providers a 3% rate increase that was effective as of July the 1st of 2021. And so at this point, I'm actually thinking we're going to have a deficit in early intervention. The only good thing about early intervention is they usually do a rebudget later on in the fiscal year where we can go in and ask for money. And we have always gotten the money we've asked for, but we'll see if it continues that way.
Another question on that, since, I mean, that's a mandate. We have to provide that on request. So if, so there cannot be a deficit, obviously that gets filled somewhere. So far, as you just mentioned, the Commonwealth has filled that gap. What happens when they get to a point where they just refuse, if that happens?
I would assume it will have to be the county, Gary. So I don't know who else would fill the gap if we're going to continue the services. I know one year we did not get our reallocation. They were not coming through with any answers. So we actually quit paying our providers, but it was because of the commissioners that we actually paid them in the end until the state came through with the money.
Was that during the state budget, that state budget crisis where we funded money for the general?
No, this would have been, it wouldn't have been during that period. I believe it was the year, might have been maybe the year after that. Because it was at the end of a fiscal year that we actually, and I knew we were out of money. So it was like, what else was we were supposed to do at that point? But I remember after we came to the commissioners with that, they said, please pay the providers. And, but the state did come through with the funding.
Okay, so it was just, the state made good on it.
The state did make good on it. So, and in my 20 years, the state has never not made good on it. One year, they actually took money out of IDD and flipped it over into early intervention.
Yeah, there's a solution.
Yeah.
Yeah. So unfortunately, now we're in the block grant, so I don't know if they can do that anymore.
And that raises a question too, I think at some point, not now, but we had a lot of hesitation on the block grant decision. And then I think ultimately the discussion was that it was a good decision. So I'd like to revisit that at some point and just get your opinions, all of you, and whether that is still a net gain for us or if that needs revisited anyway. Is that even an option to revisit? Or is it once you're in, you're in? Okay.
I think you can reverse. Yeah.
Okay.
I think that was one of the options.
Okay. But we don't need to address that today, but it's something we should revisit from time to time as circumstances change. Thank you.
Any questions for Andy or Sue? Is aging?
Christine voting is on.
Okay.
We are all here.
Hi, Christine.
Hello. For the aging side of the house, we will receive American Rescue Funds again this coming year. Our American Rescue Funds were divided into 3 years, so we're receiving a little over $200,000. This is the second year, so we'll have one additional year after that. We are also, with the interstate federal funding, Cumberland County received an increase last year when the funding was redone. That is also being spread over 5 years, so we will have an increase in that funding as well, which will be approximately about $80,000 this coming year. Currently, we're using CARES funding, and with the CARES funding, we have been able to add new providers, which has been a help to us, but we still have a waiting list because as the other groups have stated, well, they didn't state it, but are having the same issue that although we've added providers, providers still do not have workers. So we still have a waiting list where it comes to providers, but it is getting a little bit better at this time. One of the other things that we have done with our CARES funding is that we have added some new programs, which is for hoarding for our protective services to use the most. We've also added pest control, and we're looking at lawn and snow removal. As a matter of fact, this will be on the workshop tomorrow to go out for bids for us to get providers to provide those services. We have had also an increase in a program that we use is the fiscal agent, which is not a funding source, which is another way to get providers. And in that case, a consumer becomes the provider and they hire their own attendant. That has increased because of not having actual agencies to provide the services. We also have been working with providing more meals and things because we've had an overabundance of money this year, and it looks like we'll have an abundance of money this coming year, which is very odd for us. In a couple of years, we'll be back down to be begging for money again and those types of things. And so that's the aging side. Kim?
Okay, my side's pretty simple. The Human Services Development Fund and the rental or the Homeless Assistance Program under the Human Services Block Grant is, again, it's anticipated to be level funded, which other departments have already said. The Emergency Rental Assistance Program funds, which is less restricted, decreased our rental assistance spending this past fiscal year. We've already seen an increase in calls since they stopped taking new clients as of April 1st. So we anticipate being able to spend more of those funds in the next fiscal year. The food programs are also anticipated to be level funded. That's all I have.
What else we got?
I think that's all of them.
Anything they want to add? Did you hear anything from one of the other departments that triggered anything? Questions on the report? I guess I have one question, and that is, we've been a notoriously low unemployment rate county for a long time, and a number of the staffing shortages that you refer to are really nothing new. And most likely, at least some of them, if not most of them, aren't going to be resolved by simply putting money on front. Those people just aren't there. So are there solutions available to us in those fields that we can think of, or are there other resources we can pool resources with other folks to try to come up with some type of better utilization of the resources there? Or, and then one of the things we talked about with the MH side is the development side of attracting people in and actually assisting them in getting up to qualification. So money's part of the solution in some instances, but it's not the solution. So are we adequately addressing the other solutions?
I have a few comments on, there are other initiatives that are trying to provide additional resources. The different state agencies, Department of Human Services, Department of Drug and Alcohol Programs, been able to take some of the, and I lose track whether it's ARP money or some other emergency funds that they received. They were able to provide some incentive, provider stabilization, I think they call it, funding to providers with the intent that it would be available for recruitment, for retention bonuses. We were also able, through our 5-county health choices, to provide some payments toward that end. So there are some nice efforts going on outside of the county resources. In terms of other ideas, I guess the one thing I'm impressed with is Children and Youth has a good relationship with the universities in encouraging interns to come and work at CYS and get some real life experience as part of their academic internship. And I think to the extent that and I had a conversation recently with Derek in HR. He said that human resources is very interested in looking at ways that maybe they can expand upon that or encourage that throughout the county, not just human services, as a way to cultivate some talent and maybe introduce Cumberland County government as well. And the advantages, I think there's a lot of advantages of working for this county as opposed to other counties.
Yeah, the new hires that we get from the programs, the internships, they're the longest term. I get the longest out of them. They stay longer. They already know about the job when they come in. We've worked really hard with the university. So there's an early class where they shadow a worker for a day. We usually see them then. And then if they end up declaring child welfare or social work as their major, then they come back at us for an internship. So it is really good. It takes that initial shock of what we do that you can't really describe in an interview away. So yeah, they become one of the best hires.
Get them certified too.
And yeah, while they're doing their internship, they're with us for 975 hours. So we actually send them through the training that's required. So when they graduate and we hire them, they're a certified worker and ready to start working.
So are we extracting some type of obligation from them as a coming here before we do that?
So if they are in that program, they have to work in child welfare then for 2 years.
That they're coming here, not going to
Yeah,
chambers.
they're our best. Any applicant we take as many as we can from the university. We've had up to 5 at a time.
Now,
I mean-
that program provides them with some tuition assistance.
It does. It's Child Welfare Education, I think is what it's called, CWEL. It's through Pittsburgh, University of Pittsburgh. So it's a child welfare to help increase the child welfare. There's always been talk about adding other human services to it.
So what was the connection to University of Pittsburgh?
It's through the University of Pittsburgh. It's the Child Welfare Educational League. CWEL is the acronym, CWEL. And so those students sign up to go into this program while they're at Shippensburg, Millersville, one of the colleges. And so they get paid by the university, not through us. They get paid to do that, and they have to work for 975 hours in a child welfare setting. When they graduate, they have to be placed in a child welfare agency. So whether it's ours, we have to always have an opening. But right now, we've had from other areas, they've done their internship in another agency, but they live here. So they come back and then we end up still taking advantage of them. And then they have to work for 2 years, or they have to pay all that time back, pay that money back.
How long have we had that in place?
25 years.
Yeah.
You know, when
Okay.
they first started at Cumberland, we were the pass through.
Yeah.
And then
So we speak at all the universities. We really try. That is definitely a really good way to get employees.
They're all, the universities in particular, but other educational facilities as well, are very interested in workforce development. Of course, through K, we're working state angles on workforce development. So, that's an area that where we need more people. That may be something we want to be talking to Kate about as well.
Yeah. It's wonderful.
Yeah, good.
Thank you.
Guys, thank you very much. That's our only topic of discussion on the agenda today, so that takes us to item 5, which is the. We don't stand on formalities. Item 5 is just other business. We'll be done in 30 seconds. Any additional? No. Staff. Okay, that's then item 6 is motion for adjournment.
To adjourn.